HemoTypeSC is a rapid test for sickle cell disease, sickle cell trait, and hemoglobin C disease that is now available as a research use only tool. This test uses monoclonal antibodies to directly detect hemoglobins A, S, and C in just 1 microliter of whole blood and delivers results at the point of care in about 10 minutes. HemoTypeSC does not detect fetal hemoglobin and is ideal for screening newborns. HemoTypeSC is easy to use and can be performed virtually anywhere at the point of care. HemoTypeSC does not require electricity, refrigeration, or sample transport. Please read and follow all instructions. Ensure that all appropriate biohazard containment procedures are followed and that personal protective equipment is worn, including gloves, a lab coat, and eye protection. Since blood will be drawn and transferred, please follow applicable safety procedures to prevent blood-borne pathogen contamination. First, squeeze the bulb of the dropper pipette, then insert the tip into the water source. Release the bulb so the pipette fills with water. Then, gently squeeze the pipette bulb so 6 drops of water slowly drip into the test tube. The water drops should fall freely into the test tube without touching the sides. The total amount of water in the test tube should be about 250 microliters. Place the test tube in a rack to simplify multiplexing. Next, take one blood sampling device out of the plastic tube. The blood sampling device is used to obtain the blood sample and add it to the test tube. Use an alcohol swab to clean the patient's skin. The middle finger is appropriate for adults and children, whereas the heel can be used for newborns. Use a lancet to pierce the skin. Only a small drop of blood, or approximately 1 microliter, is required. Wait for a droplet of blood to accumulate. Gentle squeezing may be necessary to encourage accumulation. Next, touch the white pad to the blood droplet until the pad turns completely red. Clean residual blood and dispose of it in a biohazard waste container. Insert the blood sampling device into the water and swirl to mix. Make sure all liquid is at the bottom of the test tube by tapping the vial gently on a flat surface. Double check that the tip of the blood sampling device is completely submerged in the water within the test tube. Wait 1 minute, swirling the test tube occasionally. Ensure that the water has become pink or light red in color, which indicates that the blood has been properly transferred into the test tube. Leave the blood sampling device inside the test tube. Take one HemoTypeSC test strip and insert it in the test tube with the arrows pointing downward. Make sure all liquid is at the bottom of the test tube by tapping the vial gently on a flat surface. Be sure that the tip of the HemoTypeSC test strip has been completely submerged in the water. Wait 10 minutes. Do not remove the test strip from the water at any point prior to 10 minutes. Take the HemoTypeSC test strip out of the test tube and read results. Compare the test strip to the results chart on the back of the instruction sheet. Reading HemoTypeSC test results differs from other rapid test results such as pregnancy or malaria tests. For HemoTypeSC, look for the missing line to determine which hemoglobin is present in the patient's blood. If a line appears, that hemoglobin is not present. If no line appears, then that particular hemoglobin variant is present in the patient's blood. Red lines may appear at each of 3 hemoglobin variant-specific locations: hemoglobin C, hemoglobin S, hemoglobin A, and a control location. The control line will always appear if the test has been run properly. If the control line is missing, repeat the test with a new HemoTypeSC test strip. Let's review how to read the results. First, homozygous for hemoglobin A or HbAA. This is the wild type or normal hemoglobin type. If the test line for hemoglobin A is missing, but the lines for the control, hemoglobin S and hemoglobin C, are all present, then the patient's blood is positive for hemoglobin A. Next, homozygous for hemoglobin S or HBSS. This is sickle cell disease. If the test line for hemoglobin S is missing, but the lines for the control, hemoglobin A and hemoglobin C are all present, then the patient's blood is positive for hemoglobin S. Next, homozygous for hemoglobin C, or HbCc. This is hemoglobin C disease. If the test line for hemoglobin C is missing, but the lines for the control, hemoglobin A and hemoglobin S, are all present, then the patient's blood is positive for hemoglobin C. Now let's go over heterozygous hemoglobin type. Hemoglobin AS, also known as sickle cell trait. If the test lines for both hemoglobin A and hemoglobin S are missing, but the lines for the control and hemoglobin C are present, then the patient's blood is positive for both hemoglobin A and hemoglobin S. If the control line does not appear, or there is any confusion about the test result, repeat the procedure with a fresh blood sample and a new HemoTypeSC test strip. HemoTypeSC is an easy-to-use and inexpensive rapid test for sickle cell disease. It's currently available as a research-use only tool. Please contact us at Silver Lake Research for more information.